pharma space. This is basically in the area of pharmacovigilance. Pharmacovigilance is an area where you try to capture any kind of adverse event around a drug. When the drug gets launched into the market or a drug is in the preclinical trial stage, the adverse event about the drug needs to be reported as part of the regulatory aspect that we have. It is not only the reporting part. Once the adverse event gets booked, we need to understand the complete adverse event related information around the medicine, around the impact, and also the details about that individual before we report it to the safety database. The whole process is a very manual intensive process at this point of time, because you need a lot of subject matter experts who understand this medical terminology. So what we have done today is we have changed the complete manual process into an automated process. When we say automated process, it is not a sheer process automation like a robotic process automation. It is a complete artificial intelligence and cognitive methodology to have the platform behave like an individual, which is basically a case processor, who used to sit behind the machine once the case received and able to understand and interpret or infer from that case. So today, that individual gets replaced by the platform, who just takes the input from any format, be it a text format, be it a voice channel format, or any other format, and able to infer the complete content like a human agent who is sitting behind the machine today and doing it. So that's the platform is all about. The whole process is a very complex process, right? Because what we are trying to imitate here, or rather automate here, is a human mind. And that's the most complex aspect. And the knowledge what we have, we bank on our domain expertise in this area, because there are a series of experience which we have got when as a manual process we are managing this data, and that's the knowledge base which we have utilized to fit it back into the system as a learning. So today with the accuracy, which is almost 100% accuracy, we are able to report a case with the same accuracy. We will be also able to manage it within the platform. So it's a learning which gets transferred into the platform. The complexity is enormous, because you are basically capturing information in any format, turning it into a machine readable format, and that's the very first step of it. That could be an image, that could be a scanned document, that could be a voice chat, and then from there you are trying to figure out whether it is an adverse event or not. Once you identify that, you are also trying to figure out all the necessary information that you need to extract from this information, from this content, to report to the safety database. So a technical challenge is there, but at the same time, the whole technology space is evolving in this area. That is where we need to utilize or do a perfect balance between the domain and the technology to understand which can be achieved and which cannot be. Today the problem in AI space is we feel everything can be cloned as a machine, which is not the right approach, because the amount of customization which is required at each phase will be really expensive if we don't figure out a perfect area and identify whether it is a right candidate for automation or not.
Does Wipro
There are quite a few competitors in this area, because everybody understands, even our customer today understood that this area requires a significant amount of automation, because it is becoming extensively people dependent. There are few subject matter experts who can only understand this, right? And this also has an impact on your drug releases, how you take your drug to the market, because you constantly need to be vigilant over it. Even in the clinical trial or preclinical trial mode, this information fit back into that R&D system, right? So your drug discovery requires all this input. So the moment you make this this adverse event, any kind of medical information, that gets fed back into the system in a streamlined process, the whole process of drug delivery system becomes quite efficient. So all pharma companies understand the need of automation. The problem here is the complexity. The process complexity is pretty high. They're taking small steps. They want to understand the impact of it. It was always a need of the pharma company to see that a particular platform is available to be used, and that's what Wipro has provided today to the company, telling that here it is for you to use. You do the trial, you understand the benefit that you are getting from the platform, and take it to the market. It's quite interesting because the right question, they understand the problem, they understand the complexity of the problem, they also understand that there is a need for technology to bridge the gap. So I could see the questions are all from that aspect, and also the problem statement which the customers are facing today, and accordingly they are also asking the perfect question which the customer have asked us when I take this platform to the market. So it is quite an honor to answer those questions. It's quite an, I would say, a satisfactory feeling to understand that we're in the right path, because everybody understands the need, but it is a courage to jump into it and create a solution of that nature, which is not a process-centric automation, but really changing the transformation, the way we manage pharmacovigilance today.
For more updates from CXO TV, please like and subscribe to our channel.